Hello friends, welcome all of you on my YouTube channel here, Anand's Nursing File. Today in this video, we'll learn about the nursing care plan of pneumothorax disease here. In this video, you learn this care plan very easily or simply, and this is useful for examination purpose, both theory and practical exam. तो friends, आप वीडियो के थ्रू यहाँ आसानी से न्यूमोथोरैक्स का नर्सिंग केयर प्लान लर्न कर सकते हो। तो आइए देखते हैं नर्सिंग केयर प्लान ऑन न्यूमोथोरैक्स। यहाँ पर नर्सिंग केयर प्लान से पहले एक शॉर्ट इंट्रोडक्शन देखते हैं। व्हाट इज न्यूमोथोरैक्स एयर? न्यूमोथोरैक्स मीन्स एयर कोलैप्स लंग्स। इसके नाम में हम इसको कोलैप्स लंग्स के नाम से भी जानते हैं। देखते हैं। Pneumothorax is air in the pleural space causing partial or completely lung collapse. Pneumothorax is defined as the presence of air in the pleural space. Next, defining characteristics means on the basis of these characteristics means signs symptoms of pneumothorax. We write the nursing care plan. यहाँ देखते हैं defining characteristics. Sharp chest or shoulder pain made worse by a deep breath or a cough. Next, shortness of breath. Next, nasal flaring from shortness of breath. Next, a large pneumothorax cause more severe symptoms including bluish color of the skin due to lack of oxygen, chest tightness, lightheadedness, and near fainting. Next, easy fatigue, abnormal breathing pattern or increased effort breathing, rapid heart rate, shock and collapse. तो ये साइन सिम्टम्स है, इनके बेसिस पर हम यहाँ नर्सिंग केयर प्लान तैयार करेंगे। Here nursing care plan and nursing diagnosis for patient with pneumothorax. Here first नर्सिंग डायग्नोसिस होगा यहाँ पर इम्पेयर्ड गैस एक्सचेंज। तो हमने यहाँ पर नर्सिंग केयर प्लान के सभी स्टेप्स, जो नर्सिंग प्रोसेस के स्टेप्स हैं, नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल एवेल्यूशन, हम यहाँ यूज़ करेंगे। इस तरह से यहाँ केयर प्लान को हम तैयार करते हैं। फर्स्ट देखते हैं यहाँ पर नर्सिंग असेसमेंट में सब्जेक्टिव डाटा। Here the patient reports shortness of breath and chest pain, and objective data here cyanotic fingertip and lips, tachycardia, tachypnea, hypoxemia, respiratory acidosis. On the basis of these data we write here the nursing diagnosis. Here impaired gas exchange related to decrease in the functioning lung tissue as evidenced by hypoxemia. गोल होगा to improve gas exchange, nursing intervention and rational। देखते हैं इसका फर्स्ट इंटरवेंशन। डिटरमाइन etiology and precipitating factors, spontaneous collapse, trauma, malignancy, infection, a complication of mechanical ventilation। rational होगा understanding the cause of lung collapse is necessary for proper chest tube placement and choice of other therapeutic measures। तो यहाँ पर हमने नर्सिंग इंटरवेंशन एंड रेशनल लिखा है। यहाँ इम्प्लीमेंटेशन हमने नहीं लिखा है, ये आप लिख सकते हो आपके केयर प्लान में, क्योंकि इम्प्लीमेंटेशन एक्टिंग फेज है जो अपन ड्यूरिंग द प्रोसीजर मीन्स आपने जैसे कि फर्स्ट जो इंटरवेंशंस कंप्लीट किया है तो आप उसको इम्प्लीमेंटेशन में लिख सकते हो। नेक्स्ट सेकंड देखते हैं यहाँ पर चेक आउट रेस्पिरेटरी फंक्शंस। रेशनल होगा रेस्पिरेटरी डिस्ट्रेस एंड चेंज इन द वाइटल साइन। नंबर थर्ड ausculted breath sound here atelectasis means lung collapse area will have no breath sound and partially collapsed area have decreased sound. Number fourth, assist patient with splinting painful area when coughing, deep breathing. Rational होगा supporting chest and abdominal muscle make coughing more effective and less traumatic. Number fifth, intervention maintain a position or comfort usually with the head of bed elevated, turn to the affected side, encourage patient to sit up as much as possible। रेशनल होगा promotes maximal inspiration, enhances lung expansion and ventilation in the unaffected side. Number 6 intervention होगा monitor oxygen status here. Worsening in the hypoxemia may indicate need for increased oxygen support such as intubation. Number 7 intervention, if a significant amount of blood, that is 1500 ml, above 1500 ml, is found in the pleural space, a thoracotomy may be recommended. Rational होगा a thoracotomy surgically open the chest wall and can more effectively drain large amount of air and blood from the pleural space. Number 8 interventions, prepare for chest tube placement. Air rational होगा a chest tube will evacuate the air or fluid allowing the lung to reinflate. After providing these interventions, we write here the evaluation steps for this care plan, and here evaluation होगा नाउ इम्प्रूव्ड गैस एक्सचेंज मीन्स जो हमने गोल यहाँ तैयार किया था उसको यहाँ हम अचीव करते हैं थ्रू दीज इंटरवेंशंस, और इसको हम इवेल्यूशन में लिखते हैं. गोल था टू इम्प्रूव गैस एक्सचेंज, तो इसको सिंपली हम लिख सकते हैं नाउ इम्प्रूव्ड गैस एक्सचेंज. तो ये था फर्स्ट केयर प्लान. नेक्स्ट देखते हैं केयर प्लान नंबर सेकेंड. सेकेंड डायग्नोसिस होगा यहाँ पर रिस्क फॉर इंजरी. यहाँ भी हम सेम नर्सिंग प्रोसेस स्टेप यूज़ करने वाले हैं जिसमें नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रीजनल एंड एवेल्यूशन. नर्सिंग असेसमेंट में सब्जेक्टिव डाटा नॉट एप्लीकेबल एंड ऑब्जेक्टिव डाटा. द पेशेंट इज रेस्टलेसनेस एंड एंजियस, hypoxemic on ABG, chest X-ray. Here, nursing diagnosis, risk for injury related to a collapsed lung and subsequent chest tube placement. गोल होगा टू reduce risk for injury. नर्सिंग इंटरवेंशन रेशनल देखते हैं. फर्स्ट इंटरवेंशन, explain with a patient purpose and function of the chest drainage unit, taking note of safety features. Rational होगा information on how the system works, provide reassurance reducing patient anxiety. For second intervention, advise patient to avoid lying and pulling on the tubing. Here rational होगा reduces the risk of obstructing drainage and inadvertently disconnecting tubing. Number third, identify change of situation that should be reported to caregivers, such as change in the sound of bubbling, sudden air hunger and chest pain, disconnection of the equipments. Rational होगा timely interventions may present serious complications. Number fourth intervention होगा anchor thoracic catheter to chest wall and provide an extra length of tubing before turning or moving patient. Here rational होगा prevents thoracic catheter dislodgement or tubing disconnection and reduces pain and discomfort associated with the pulling or jarring of tubing. Next intervention, secure tubing connection site. Here prevent tubing disconnection. This is rational. Number 6 intervention, perform a fall risk evaluation and enact the proper safety interventions. Rational होगा the fact that the patient is attached to a chest tube unit in addition to being restlessness, anxious and hypoxemic means he is at high risk for fall. Next, change the chest tube dressing daily and as needed, monitoring the site for sign and symptom of infection. Additional होगा aseptic techniques for dressing change is important for infection prevention. Redness, warmth and drainage can indicate an infection. Next, palpate chest and neck for crepitus. Here रेशनल होगा subcutaneous emphysema is the complications of chest tube and indicates an air leak into subcutaneous tissue which can be life threatening. Number 9 intervention होगा monitor the chest tube unit for any bubbling or leakings in the tubing aeration होगा bubbling can indicate a leak kinking or clamping can cause a tension pneumothorax do not clamp without a physician's order. But 10 intervention होगा tape all connections of the chest tube and maintain the prescribed level of suction aeration होगा. It's important to maintain a closed system free from leak. Suction can vary from 10 to minus 10 to 20 mm per Hg and rarely exceed minus 25 mm per Hg. Next, observe for sign of respiratory distress if the thoracic catheter is disconnected or dislodged. Aeration होगा pneumothorax may recur or worsen, compromising respiratory function and requiring emergency interventions. After providing these interventions, we write here the evaluation steps. यहाँ पर evaluation होगा जो गोल था हमारा टू रिड्यूस रिस्क फॉर इंजरी उसको हमने इन इंटरवेंशंस के थ्रू अचीव किया है. तो यहाँ evaluation होगा रिस्क फॉर इंजरी रिड्यूस्ड. नेक्स्ट देखते हैं केयर प्लान नंबर थर्ड केयर प्लान होगा अक्यूट पेन. देखते हैं इसमें नर्सिंग असेसमेंट में सब्जेक्टिव डाटा द पेशेंट रिपोर्ट चेस्ट पेन. Objective data the patient is restlessness, anxious, tachycardia, and tachypnea. Diagnosis होगा acute pain related to the positive pressure in the pleural space. Goal to relieve pain. Nursing intervention rational देखते हैं. First manage pain with the prescribed analgesics. Rational होगा lidocaine should be administered locally with chest tube insertion intravenously. Fentanyl and morphine are commonly prescribed to manage chest tube pain. Next, monitor oxygen status and the effect of analgesia. Here, rational होगा opiates can depress the respiratory system and should be used judiciously. Naloxone should be used to reserve opiate if overdose or complications are noted. Next, third interventions utilize non-pharmacological pain relief measures. Cold applications, relaxation techniques have been shown to help relieve pain without the use of medications. Number 4, stabilize chest tube to the patient with the adhesive device. Here rational होगा. This prevents any pulling or accidental removal of the chest tube. Next, fifth, educate patient about the interventions such as sitting upright or splinting the chest with pillow while cuffing has been shown to significantly lessen the pain. It's also important to educate the patient about the importance of taking deep breaths to prevent pneumonia. Tools such as incentive spirometry can be helpful. After providing these interventions, we here write evaluation steps. Now here evaluation is now pain is relieved. मीन जो हमारा इंटरवेंशन था टू रिलीव पेन वो हमने अचीव किया है थ्रू दीज इंटरवेंशंस. नेक्स्ट देखते हैं केयर प्लान नंबर फोर्थ केयर प्लान होगा रिस्क फॉर इन्फेक्शन. इसमें सब्जेक्टिव डाटा नॉट एप्लीकेबल बिकॉज दिस इज द रिस्क डायग्नोसिस. ऑब्जेक्टिव डाटा वाइटल साइन असेस साइन ऑफ इन्फेक्शन असेस CBC रीडिंग्स. एयर diagnosis होगा risk for infection may be related to invasive procedures, traumatized tissue skin, broken skin. Goal to reduce risk for infection. Nursing intervention risk लिखते हैं. First, promote for good hand washing. Staff and visitors screen and limit visitors who may have infections. Place in reverse isolation as indicated. Risk होगा protects patient from source of infection such as visitors and staff who may have upper respiratory infections. Number second, monitor vital sign and sign of infection. Here provide baseline information to interventions. Number third, keep patient in isolation. ये risk होगा. Isolation reduce risk for infection. Number fourth, inspect site of invasive device. Nothing sign of infection here. Early recognition of the sign of infection here. Administer an antibiotics as indicated here. Risk होगा may be used to treat identify infection or given prophylactically in immunocompromised patient. After providing these interventions, we write here the evaluation steps. Here evaluation is risk for infection reduced. जो goal था हमारा to reduce risk for infection वो अचीव है through these interventions. Next देखते हैं care plan number 5th. फिफ्थ और लास्ट केयर प्लान है डेफिशिएंट नॉलेज नर्सिंग असेसमेंट में सब्जेक्टिव डाटा patient asking questions about pneumothorax, objective data looking anxious and irritable. Next, nursing diagnosis. A deficient knowledge may be related to lack of exposure to information. Goal to improve level of knowledge. Nursing interventions में first देखते हैं review pathology of the individual problem में रीजन होगा information reduces the fear of unknown. Next, second, determine the likelihood for recurrence and long-term complications. रीजन होगा certain underlying lung disease such as severe COPD and malignancies may increase the incidence of recurrence. Number third, interventions reassess signs symptoms requiring immediate medical evaluation such as sudden chest pain, dyspnea or air hunger, progressive respiratory distress, irritation होगा. Recurrence of pneumothorax require medical interventions to prevent or reduce potential complications. Number four, interventions review the significance of good health practices, adequate nutrition, rest, exercise, rest, maintenance of general well-being, promote healing, and may prevent or limit recurrences. After providing these interventions, we write here the evaluation steps. Here evaluation होगा. Now improved level of knowledge. Goal तो हमारा to improve knowledge उसको हमने अचीव किया है थ्रू these interventions. तो फ्रेंड्स ये थे हमारे नर्सिंग डायग्नोसिस एंड केयर प्लान्स फॉर न्यूमोथोरैक्स पेशेंट. फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद योर फ्रेंड्स एंड सब्सक्राइब माय यूट्यूब चैनल अन नर्सिंग फाइल preparation for the nursing competition examination and here we provide various nursing related material, nursing notes, nursing care plans, case study, community health nursing, family folder, case study, image based questions and so many material related to nursing. So please subscribe my YouTube channel and press bell icon also. Thank you.